Let's run through performing point-of-care ultrasound of the kidney and bladder. I'm going to start with the probe in the mid to posterior axillary line. And at this point, if the probe is pointed into the plane of the body, we should see the liver. The image shown is using the radiology convention, which means the probe marker is on the left of the screen, and I'm holding the probe with the marker towards the head. Both the probe and the screen on that side are labeled in red here for clarity. The kidney is posterior and inferior to the liver. So to find the kidney, you can either tilt the probe or sweep posteriorly. Then we have to remember our anatomy. The long axis of the kidney is not in axis with the body. So to find the long axis, rotate until we identify the longest kidney we can. You can see how the long axis is not in the plane of the body and is typically found with a posterior rotation. The long axis is important for helping us determine if there is some element of CKD. CKD is much more likely if the long axis is less than 9 centimeters. Other clues for CKD are cortical thinning and increased cortical echogenicity. Once you've measured the long axis of the kidney, sweep through it by tilting anteriorly and posteriorly to evaluate its full extent. Then you can find the short axis of the kidney by rotating further posteriorly and sweep superiorly to inferiorly. Remember, any abnormalities should be seen and evaluated in multiple planes. Finding the left kidney is similar, though is often slightly more superior, and when using the spleen as an acoustic window, it is more posterior. Next, we're going to move on to the urinary bladder. The utility at the point of care of visualizing the bladder is for volume estimation and confirming Foley placement. Volume estimation requires 3 measurements in 2 views. These are multiplied and then adjusted by a correction factor. We suggest you use 0.75, though there are multiple. Sweep through the bladder in transverse, just above the pubic symphysis. In this example, we see not just the bladder, but the prostate and the rectum. In females, you may see the uterus. Pause at the largest bladder you can find and measure the height and width. Then transition to the long axis by rotating the probe marker towards the patient's head. Freeze and measure the bladder's depth. Now you have all the measurements you need to estimate bladder volume. For more in the Alan J. Goody Bedside Medicine series, visit goodybedside.com.